Good afternoon, ladies and gentlemen. This is Scanbalt Digital Forum 2020, and this is its session number 4. My name is Josef Hilbert. I am working with a network of German regions for health. That's trouble for me, but even more, it's an honor and it's a pleasure. And from this background, I was invited by the Scanbalt people to contribute to this forum, and I enjoyed to be part of this team. Thank you very much for that. Our session today is on digital solutions for a protective elderly care system. And this means we will talk about already existing solutions and the experiences we made while using them. Many of them are in a kind of pilot development. However, they have a lot of users and they already can provide a lot of experiences how they work and what can be done to make them better, to optimize them, and to go for a wider use, for a broad deployment of promising solutions. This is the background why we come together now and why we will exchange experiences and learn from each other. And furthermore, we will debate what can be done to make, to push promising solutions for a wider, broader use, for a big deployment, and how to use the joint declaration for this process. So far as a kind of introduction, now I would like to address the inputs, and we will start with a colleague from Denmark, from southern Denmark, from the Southern Denmark Institute of Health, Center of Health Innovation. And this center is very well known for its approach on welfare technologies. And Bisljim Braimi is working with this center, and today he will tell us something about the video consulting system, video consulting solutions during the COVID-19 crisis. So please start this pre-recorded input.
Yes, my name is Bisljim Braimi and I'm from the region of Southern Denmark. First, I would like to say thank you for giving me the opportunity to tell you a bit about our rapid deployment of digital solutions in the region of Southern Denmark during this pandemic. I would like to start my presentation by giving you a few details about the Health Innovation Center of Southern Denmark. We are approximately 70 employees who support the hospitals in Southern Denmark in their innovation efforts. So we work with a lot of projects where our expertise in innovation, user involvement, and digitalization plays a huge and important role. Yes, the focus of today's presentation is about the rapid rollout of video consultation during this pandemic. And in the region of Southern Denmark, we are actively and increasingly utilizing digital solutions in the pandemic context to support the safety of the citizens of the region of Southern Denmark. The region already has a strong infrastructure in place for the use of telemedicine across sectors, and we have been working with digitalization for a very long time. And this, of course, has enabled us to expedite the rollout of video consultation during this pandemic. So before the pandemic, the region of Southern Denmark was gradually rolling out secure video consultation for the GPs, the general practitioners. And we have about 800 of them in our region. So this rollout has been done in the context of COVID-19 to secure that the citizen can have video consultation with their general practices from the safety of their own home. Yes, and now I would like to talk about the challenges of this project. As you all know, the general practice was not allowed to meet with their patient during COVID-19, so there were not any face-to-face meetings with their patients. So we knew that if the general practices could not meet with their patients face-to-face, then we knew that we have to do some kind of a rapid rollout of video consultation. And the issue and the challenge of this project was also that not all GPs were familiar with video consultation. So it was a huge task. So the solution to the challenge was that we established a support team consisting of 7 employees. And we also arranged a support line, a phone line where the GPs could call in and ask if they had any questions about the video solution that we could offer them. We also made a lot of guides for the general practitioners so they could get in touch with their patients from the safety of their homes through some video consultation. And we also had some equipment shipments. It was not all GPs who had video consultation, so we had to send out microphones and web cameras and all sort of things. Another important aspect in this situation was that we also had to focus on competence development for GPs and patients. It was not all GPs who knew how to work with video consultation. So we did spend a lot of time on explaining them how to work with the different video solution. I think in the beginning of the pandemic, we received about 40 to 50 calls a day from different GPs who were looking forward to get started with video consultation so they could stay in touch with their patient from the safety of their homes. So we had 3 different solutions for them. We had the one-way SMS video solution, we had the My Doctor application, and we had the planned video consultation. These are 3 different video solutions with their own, how can you say, like style, their own user-friendly and so on. The one-way SMS video solution was a very easy solution. The only thing that the GP had to do was to type their patient's number in a system, and then the patient receives a text message on their phone with a link that they could press on, and then they would join a meeting room where the GP is waiting for them. So this is probably the most user-friendly solution we have. The My Doctor application is this is an application that the citizen can install on their phone, and then they can be in contact with their GP through the app. And they also have the opportunity to see their medicines and different kind of results. So this is an application that was based around video meetings. So you just install the application, and then you just press a green button which says enter the meeting room, and when you do that, then you are in line to come in contact with your GP. This application is a bit more complex than the one-way SMS video, but a lot of doctors, GPs used it during the pandemic. And the last one is the planned video consultation. And here you have a booking system where you can book a patient and send them an email. In the email, they'll get a link that they can press on, and then they enter the meeting room. So the challenge in this video solution was that we had to find a video solution that fits all GPs, that fits the GPs who were very technical, but also the GPs who were not that technical. And that's why we had the one-way SMS video solution for the GPs who were not that familiar with video consultation. The only thing they had to do was to type a number, and then the patient receives a text message with a link that they press on, and then they enter the meeting room via Safari or Google Chrome. The planned video is a bit more complex and was not used by so many GPs because it is a bit complex, but the GPs who knew about it, they of course used it because it comes with a lot of benefits when you can book a meeting with the patients. You can see here, this is a very interesting statistic. You can see that in February and March, we had a really high increase of video consultation. And during May, where we opened the country up a bit more, we saw a decrease in video consultation, which was also expected. So what we learned that more GPs are comfortable with using video consultation. It is possible to implement technology when it's necessary and when the context is in it, like right now during the pandemic. And it has been easier to convince GPs to use video consultation in the future because now they have tried it and they have seen the benefits of it. Yes, so you are more than welcome to contact me if you have any questions regarding the different video solution or regarding how we establish a support team that could meet the requirements of the COVID-19 pandemic.
So thanks, Bisljim. I have a lot of questions to your contribution. However, it's a pity that you do not have the opportunity to join us today. A couple of minutes before we started this session, the organizers received a mail by Bisljim, and he said, "I'm sorry to inform you that I cannot attend today because of some private reasons. I cross finger that he will solve his private reason problems, but it's for us it's an unlucky situation that we cannot put some questions on him, ask him for more information, but there is no other choice. You have to address him via email. You know his address, or you have to phone him to get in closer contact to him, but he will welcome your questions and he will respond to them and answer them." So far to Bisljim Braimi, very interesting and very, let me say, promising input. Now I want to address Eila Erkkilä. I hope I pronounced your name well. Sorry if not. Dr. Erkkilä is from Oulu in Finland, and she is deputy chief physician at the Oulu Hospital or Health Center. And she will talk on, let me wait a minute, digital patient monitoring system of triage, the Kaikuhealth App. So the floor is open to you. You are welcome.
Hello, my name is Eila Erkkilä. I work as a deputy chief physician in the city of Oulu. I am happy to tell you about the Kaikuhealth solution in monitoring the COVID patients in home care. The city of Oulu is situated in northern Finland, and we have about 200,000 citizens at the moment. We know the COVID symptoms range from mild to severe, but how can we find the patients with serious symptoms in time? The patient gets access to echo system when the patient gets positive test result. And the patients at home report their symptoms daily via echo system. In the beginning, there are a few questions to define the risk groups of the patients, and then there is reporting daily symptoms, for example, for 2 weeks. The patient gets immediate feedback after the survey every day in traffic light mode. So the green light means the home care continues. Yellow light tells the patients to call own health center or corona phone. And the red light means the patient should call emergency. And nurses in health center receive alerts for severe symptoms reported and also can contact patients according to urgency. The nurses also get an overall picture of patients' health and symptoms. This is the nurses' overview of reported symptoms on example according to the traffic light. So the nurses can contact the patients with severe or moderate symptoms. We implemented the ECHO or Kaiku system in May when Finland's most COVID cases were in Helsinki region, and Oulu was waiting for the same amount of cases to come. The ecosystem is helping when there are a large number of patients whose screening should be according to symptoms. It's obvious that a small number of patients can be treated traditionally, for example, by phone calls. The COVID cases in Finland went up in April and May, but went down before summer months. Right now, we are facing a mild beginning of a second wave of COVID. The good situation in COVID cases is because of the national politics and guidance. I'm afraid it's not because of the Kaiku implementation in Oulu alone. All in all, the feedback from nurses who use the ECHO is quite positive. For example, for once a solution providing benefit to work processes, it's easy to use and is an agile tool when there are positive cases with many patients to follow up. I also want to emphasize the patient safety aspect. So the ECHO or Kaiku system helps the medical staff and gives safety for the patients who stay at home. And we can find the COVID patients with severe symptoms in time. It's very helpful when a large number of patients are being monitored at the same time. The Kaiku is originally a Finnish startup. It was developed to monitor the cancer patients at home. After a few weeks after our implementation, the Kaiku went global and is now part of the Elekta company. Thank you for your interest.
Eila, thank you for your input. Again, it was very interesting and helpful to learn about your activities. And again, that makes us a little bit optimistic for a more dynamic development with respect to digitally supported healthcare solutions. I have some questions concerning your contribution. However, we will debate it later in the panel debate. I now have the honor to introduce Dr. Attila Wohlbrand. Attila Wohlbrand is from Germany, as I am from Germany, but he lives close to Berlin in Potsdam. That's the capital of the state of Brandenburg in Germany, and this is the home base of a very well-known research institute, the Hasso-Plassner Institute, with its digital health center. And Dr. Attila Wohlbrand will provide us with an input on Smart for Health, a European health data space in citizens' hands. We already learned about the approach to make the patient and the people the commander of its health data, and this is a very ambitious approach to do that. You are welcome, Mr. Wohlbrand.
Okay, thank you for having me today. My name is Attila Wohlbrand, and I'll be presenting the Smart for Health project today and how it will improve the healthcare with regard to COVID-19 treatment and especially beyond. I'm project manager of the Digital Health Center of the Hasso-Plassner Institute in Brandenburg in Germany. And the Digital Health Center brings together individuals from health sciences, human sciences, digital sciences, and digital engineering, while the Hasso-Plattner Institute is a privately funded, not-for-profit research institute for IT and an independent faculty of the University of Potsdam. I've been kindly asked to represent the Health Capital Cluster today. And the cluster represents 21,000 companies, 130 hospitals, and 39 research institutes throughout Brandenburg and Berlin in Germany. My talk today will be structured as follows. I will introduce a short use case to demonstrate the focus. Then I will demonstrate and show the approach that Smart for Health takes on this behalf and describe possible solutions to the use case introduced. Okay, so I've been to Madeira this summer. One good thing that I can report for COVID-19 is that the beaches are really empty. Of course, this is only good for the tourists, not for tourism itself. Now, I'm fortunately quite healthy, and I'm really thankful for that. But assume that I have a long patient history and I want to travel somewhere else within Europe. I have to take all my files with me to really be informed and inform the healthcare professionals on site. Assume that I also want to translate those documents for Madeira, would be in Portuguese or at least into English. I actually have to take even more files with me. The challenge that we see here at Smart for Health, especially considering COVID-19, is not only to reduce those files into a digital platform, but of course also ensure that those files are really trustworthy. If we exchange data with somebody else in a different language, how should they trust that these documents are actually meaningful to share and to use for treatment? So in the current crisis, it underlines that a basic infrastructure to collect and share health information digitally is not existent for Europe, and the cross-border exchange of information has not been tackled sufficiently within Europe. Here, the Smart for Health project comes in. So how can we provide a solution where citizens are in full control of their data? And how can we realize cross-border exchange of health data? Let me shortly introduce Smart for Health project in a nutshell. So what we want to achieve is we want to have anybody within Europe be able to obtain their personalized health data in a digital format. We want them to share and manage their health data securely. We want them to share that health data easily with healthcare professionals and trusted ones. They should be able to donate, provide that data to research, make that accessible to research, and with that, provide them with personalized insights about their health. What we have done so far is within this so-called citizen health data platform, the citizens can store their data securely in a cloud infrastructure. And we have realized a registration for the Smart for Health platform on a secure manner so that only they can access the data, and it's also encrypted in a way that the operator of that system cannot access the data at all. You can self-upload your data, which you have already in PDF formats, for example, so that it's also stored in that data. And most critical here, and this is something that we are still working on, is to connect to healthcare providers so that any provider in Europe can directly connect to this infrastructure, not going through existing professional systems, but really connecting one by one the systems that are available, also national contact points, etc. With this, the citizen has all their data in their own platform, and they can securely share that data with healthcare professionals that then access via a web interface the data that is shared with them one by one. This allows the citizen also to gain health knowledge about their own data as they have it all stored from different sources in the one place. Additional to that, assuming that we have all the sources now in the citizen health data platform, the citizen has access to that data and gains knowledge about that and manages that data, they can provide that data to research in a de-identified format so that researchers and other external partners as research institutions can access the data to really provide insights about their health to the citizens. So the data-based insights can then be used to really generate personalized health services, and those personalized health services can be applied to the identifiable data on the citizen health data platform without spoiling that data to anybody else. Also, something that we are looking at is how can we recontact the citizen in case of any findings that is within the research. Now, why this will work? Citizens, we are following a citizen-centered design, so we understand what the citizens' needs are. We put the citizens in the driver's seat to enforce GDPR. Instead of providing an infrastructure that is driven by professionals, really want the citizens to take care of that, say, I want to have access to my data, I want to store my data. We do not rely on existing exchange infrastructures targeting healthcare professionals. Of course, we are connecting to them so that our system is still providing the information to the citizen. We realize translations on demand so that all the data is provided in the format and in the language that the citizen needs for the specific situation, and the data stays under control of the citizen at all times. What we also realize is that the research data is used to inform personalized health service modules that the citizen then can use to inform themselves with their identifiable data without disclosing the data to anybody. So coming back to the initial use case of sharing a trustworthy document in the COVID-19, we see that the citizen can register to the platform. They connect to hospitals or laboratories that have those test results, and they can receive the results without being able to change them, but actually they can delete it following GDPR, and the results that they share are then trustworthy for anybody that accesses the data in the language that they need it. So my name is Attila Wohlbrand from the Hasso-Plattner Institute, representing the Health Capital Cluster in Brandenburg, Berlin, and presenting the Smart for Health project. The project aims to set up a European health data space to empower citizens to manage their own health. It enables citizens to share their data across borders while being in full control. The possibility to provide data for research will foster the development of personalized health services by third parties, fully compliant under GDPR and protecting data of the citizens. Thank you so much for your attention, and I'm really interested to get engaged.
Attila, thank you so much for your input. And Attila, maybe you can already prepare for the question whether or not there are bridges to similar projects in Europe, and whether or not it makes sense to have a kind of monitoring system to yes, increase the awareness of such approaches and to encourage people and policymakers to profit from your activities. So have that in mind for the further debate. But first of all, we have to continue with the presentations, and we go to Italy, and we welcome Orientina Di Giovanni. Orientina Di Giovanni works for Care App in Italy, and that is a provider of telehealth solution for Parkinson disease during COVID-19, a long-established solution which has now come to, let me say, new relevance concerning the COVID-19 crisis, and I'm very interested in listening to your input.
Hi, my name is Ivo Dachov, and I would like to show to this event new cutting-edge technology coming from Checkpoint Cardio. This technology will make the hospital home for the hospital healthcare technology for every home or for every working place in Europe. So let's agree that we were not prepared for this COVID pandemic. Our healthcare infrastructure was not designed for that. The ICU beds dedicated for COVID were not enough. Many patients had minor symptoms, and also they needed monitoring and healthcare. And also we needed to monitor and take care of many positive patients or patients which are under quarantine. So how to take care of much more patients than the system is designed for with the same number of healthcare providers, or how to monitor those patients at their places, not to load too much the hospitals for that, and how to reduce the contacts between the medical professionals and the infected in order to save the health and life of medical professionals. We have created a small solution, very easy to be installed, web-based personal ICU monitor, which you see on this picture. It replaces all the big machineries in the hospitals, and it can be used everywhere. And it measures everything which you need to know about the COVID patients: ECG, blood pressure, oxygen saturation, temperature, respiration, pulse, and body activity. How it works, you will see in a second. very important, we have certified and industrialized this solution both as hospital and home device. So it can be used with the same quality in the hospital and both also at home. It works in this way. So here you see on the screen real patients in real time, which are monitored with hospital quality. The system is representing all the data running in real time, but also is giving alerts in real time, which are colored in red if they are very, very strong, or in yellow if they are not so strong. And it really represents hospital care for patients which are at home. If we want to see closer one patient, we are opening the personal patient file, and you can see the ECG channels running, the blood pressure, which is here, and the trends of the blood pressure, the SpO2 or oxygen saturation scale, the pulse scale, and also we see what is the body, the position of the body of the patients, under which condition the body is reproducing all this data. Also the system, the AI in the system is warning the healthcare professionals, is calculating the risk score, the deterioration risk score, and all the early warning scores. So the system is reproducing also predictive models for the particular patient. Also, we have other dashboards for monitor patients, which is with bigger stress on general physiology, with all the follow-up actions which the healthcare providers need to do during the monitor period. And also we have developed online medical reports, which you can see from everywhere, which are showing all the trends and all the alerts of the patient during the monitor period. So the system is representing real-time data, but also is showing real-time medical reports. So the care of the patient can be continuous. And in the end, we have developed one general alert board where all the patients, no matter there are 100 or 1,000 patients, are represented, and all the alerts are represented in one board, which can give priorities to the healthcare providers to whom to switch and what kind of care to provide. And it's really a system which can provide a hospital monitoring for patients which are at home. I would like to show you one report which is showing how in our first COVID-19 crisis center in Bucharest, Romania, how the system works with the patients which are under home quarantine. So you see, those are the monitors, those are the doctors, and this is a real-time patient to whom they are speaking, and they are asking, how do you feel? But upon real-time data, this is our medical application on the phone, which is transferring all the data in real time to the cloud. This monitoring center in Romania is taking care simultaneously of 300 patients right now in this real moment. So if we want to conclude how the system works and what it does, we are providing with this system much better healthcare, because we are managing the health in real time. And the patients are much less stressed because they know that somebody is monitoring them, even they're at home. And also the risk of contamination of people around them and people which are taking care of them, like doctors and nurses, is much lower. And on the other hand, we are making this healthcare and monitoring of the patients medics can monitor up to 1,000 patients simultaneously. The device can be managed by the patient himself or by volunteers, not necessarily by doctors. And also you can dedicate healthcare providers from one country which has more healthcare providers to the other country which has a big need for healthcare providers and many patients. So you are reducing the costs for logistics in this way. So the system today is saving resources, but also is saving lives. And that's why we would like to propose to the German presidency this fully integrated and industrial system for real-time monitoring and real-time healthcare to be used for the sake of all the EU patients with much less resources and with much higher effectiveness. Thank you very much.
So, thank you very much again. Ivailo, in our midterm evaluation this day at the conference, the organizers asked me what can be done to be a little bit more vital, and I promised to wake up the audience with some confusions. And that's what I did, introducing Orienta instead of you. I apologize for that, but you did a wonderful job to do it yourself. And it was a very clear contribution, and we learned a lot. Thanks a lot. And there are already questions concerning your input, comparing it with Austrian solution. Maybe you can say some sentences on that after in the panel debate. But now I address again Orientina Di Giovanni. I apologize as well to you. I hope you can live with that. And now you can start your contribution. You are extremely welcome.
Good afternoon, everybody. My name is Orientina Di Giovanni. I'm the general manager of CareApp, a digital health startup founded in 2018 to develop solutions to actually bring continuity of care to the home of chronic patients. We are based in Milan, Italy, Lombardy. We belong with Cluster Lombardo Scienze della Vita, the biggest life science cluster in Italy, being Lombardy one of the richest regions in Europe, but also, as you might have heard, a hotbed of COVID-19 pandemic in Europe. Actually, at the beginning of the pandemic here, we were ready to launch our first care and case management solution for Parkinson's disease patients to provide them full access to healthcare services directly from home. Our solution is very simply made of three things. The first one, we devote to each Parkinson's disease patient and caregiver a Parkinson's disease nurse specialist to support them daily in monitoring their symptoms, in understanding their symptoms, and providing them the advice to keep that symptoms under control on a remote basis through a collaborative digital medicine platform to share clinical information and clinical decision across the entire multidisciplinary team that is taking care of the patients. The third pillar is a suite of validated clinical algorithms that have been developed by an international movement disorder specialist team to enable standardized assessment of symptoms that patients are reporting from home. So to ensure that the orchestration, the case management of the care professional intervention is evidence-based. What about Parkinson's disease and COVID-19? So as far as we know, Parkinson's disease is not a risk factor, a specific risk factor for COVID-19 infection, but this is a disease of the elderly. And it is a disease for which there's no cure. The therapeutic window is narrowing over time, and patients are left home dealing with a great variety of symptoms that they are no longer at least, controlling very, very well. And their access to healthcare services in normal time is quite limited. They make about 2 visits per year with their doctors of about 20 minutes. And in COVID times, this is getting even worse. So at the beginning of the lockdown, when the Italian government decided to shut down hospitals and outpatient clinics to devote them to the treatment of COVID-19 patients, those patients were in a very, very bad situation. So we liaised with a number of institutions in Italy to set up the first collaborative medicine digital network in Parkinson's disease to provide those patients full access to healthcare services. What we did, The challenge, of course, was to keep on caring for those patients without moving them from their homes. We delivered about 5,000 telenursing interventions, supporting almost 700 patients. But the very interesting number for us is that amongst the patients that required medical evaluation, only 20 were admitted to in-person visits, and 7 of them to the emergency room. Those are clearly pure statistical data, so it is quite important to wonder, but how did patients found this way of dealing with healthcare services? And we ran, together with Università Statale di Milano, a patient-reported experiences survey. And we surprisingly realized that for patients, which were about 73 years old, not millennials, it was quite easy to get in touch with their nurses through a digital platform. That the nurse, not the doctor, understood their specific needs. That she gave them personalized information and advice, and that advice improved patients' ability to cope with symptoms and put them under control, and the information improved their understanding of the symptoms. Now, this initiative raised the attention of the international scientific community in the movement disorders area. In a paper published on Parkinsonism and related disorder was presented as a model to manage not only phase 1, the lockdown, but also the following phases of the pandemic. Unfortunately, the initiative was a charity one, and in a few weeks, this is meant to come to an end. Because in Italy, like in many other European countries, digital health startups are lacking a clear pathway to access the public healthcare system market. Yet, COVID-19 clearly increased our understanding that moving chronic disease to the patient home is the way forward. It boosted the adoption of those solutions, not only by healthcare professionals, but also by a population of very elderly people, not millennials, that deserve and need to be kept home and under safe conditions also in the next months. So the very main question for us is, how can we make recent digital health gains last? We know that in Europe, there is one country that recently adopted a Digital Healthcare Act to foster and set up a clear frame to get digital innovation into the system, and that's Germany, which happens to be the current president of the European Council. That's what we warmly demand to them. Let's broaden this approach to the whole European Union. Thanks for your attention.
Orientina, many thanks for your input. This input made crystal clear what challenges are waiting for us. We have promising solutions to very relevant problems. However, we have health systems which are very slow in adopting this solution, and this still even holds true for Germany. We do not yet have a clear pathway for such a Parkinson solution under the umbrella of the new regulations you mentioned. We are fighting for it, and we are hopefully that it will work, but we do not yet have a guarantee, and that's why it is so relevant that we exchange experiences and make clear we have solutions for relevant, highly relevant questions, and we have to push them for broader use. So thanks again. Now I will address Thomas Karobka, from Germany, who is familiar with the problems you outlined a couple of minutes ago. And Thomas Karobka is from Mecklenburg-Vorpommern, Mecklenburg-Pomerania, the northeastern part of Germany. And he is working with the Biocon Valley Association, a regional development association focusing on health business issues. And he has done, together with our network, I'm the head of this network, and Thomas is a very active supporter. We have tried to understand the experiences of several regions with respect to such pilot projects as were outlined before by Orientina. And I am very interested in learning about the results of this walk through Germany and of this look at these pilot projects. Thomas, it's your job now. The floor is open.
Hello, my name is Thomas Karobka and I work as a senior project manager for eHealth for Biocon Valley. Biocon Valley is the cluster for health economy in Mecklenburg-Vorpommern, Germany. It is a pleasure and honor to present on behalf of the German Regions for Health Network some of the best practice examples from the network members. The German Regions for Health Network is an umbrella association with currently 22 member regions. Network members can exchange experience and best practice, and the network represents their interests in Berlin and Brussels. Biocon Valley is a member of the network representing the federal state of Mecklenburg-Vorpommern, Germany. This map is meant to give an overview of the regions and some of the innovation projects in digital health. These are just some examples. We have collected more than 120 projects, and this is just the tip of the iceberg. To name a few of the main fields we could mention: smart health data generation and management, disease-specific remote health monitoring and coaching, outpatient digitally based prevention and rehabilitation schemes, and telemedicine and telecare. One best practice example from Mecklenburg-Vorpommern is the INGRIP project. This project addresses the challenges in cross-border emergency care. For example, unclear legal situation, communication barriers, a lack of alerting channels, and differences in professional competence. How are these challenges addressed? Well, the project consortium has worked out a program with the following 4 main fields: language training, simulation training, air rescue coordination, and to guarantee the project afterlife, there is a module for addressing sustainability issues. Another example is the West German Teleradiology Network. The network offers a number of services and is used across many departments, e.g. radiology, cardiology, urology, trauma surgery, and oncology. For the technically interested audience, there is the reference to the underlying technology, which is the DICOM email standard. The network currently contains around 465 connected facilities. Around 50,000 studies are sent monthly, which equals to approximately 11 terabytes of data. First use cases have been implemented in a cross-border setting with the Netherlands, and further cooperations are under development. The last example is Telepro. TelePro stands for Telemedical Lifestyle Intervention Program. The CARE program was developed for people with diabetes 2 and people with severe overweight. It consists of 3 components: monitoring of health parameters, an online portal, and coaching by a personal health coach. Some figures and partners are shown on this slide. For example, 3,500 patients are enrolled in disease management programs covering 6 chronic conditions. So, what are the lessons learned? Germany has a vital and powerful innovation landscape for digitally supported ways of disease management and integrated care. In many cases, it is possible to create solutions that lead to better health and better care. Regions for Health have proven to be initiators and drivers for innovative, digitally supported healthcare solutions. The first steps in cross-national cooperations have been taken. However, there are some challenges and bottlenecks. First, even good evidence-based, digitally supported solutions for disease management and integrated care are only slowly finding their way into widespread use. Germany and Europe have a deployment gap. Second, one of the main reasons is a lack of sustainable financing solutions. Third, not all traditional stakeholders profit from innovative approaches. Those who do not try to postpone broad dissemination of new ways. Fourth, cooperation between regions for health in disseminating innovative solutions is still inadequate. Last but not least, we can say that institutional, economic, and political misfits and tensions are a significant hindrance to cross-national exploitation of promising innovations. What are our hopes and recommendations? The German government is planning a new law for autumn 2020, the so-called Versorgungsverbesserungsgesetz, or in English, Health and Care Improvement Act. This is likely to significantly expand the possibilities for sustainable financing of digitally supported care solutions. The hope is that this law could bring some kind of push for digitally supported supply solutions in Germany and Europe. Sustainable financing could also bring tailwinds for cross-national collaboration. Regions for Health should support each other in the development of digitally supported solutions for disease management and integrated care. We think that such activities should be supported by EU policies and national governments. So, this was a brief input from the German Regions for Health Network. Thank you for your attention and enjoy the conference.
Thanks, Thomas. It was a perfect outline of the problems we are facing and of the hopes we have concerning the next months and concerning the German presidency of the European Union. And I'm very interested in learning about your opinions on that and or your views on that. But first of all, I have to ask Eila to respond to Frank Kettner-Nikolaus from Hanover. Greetings. Concerning a specific question on similarities of the Bulgarian system and an Austrian one. Could you give a short response to that, Eila?
Hi, everybody. Yeah, I was muted. Actually, I'm not very well. I'm more used to Microsoft Teams. Now I see that this specific questions is especially for me. I should say that I'm not aware about this Austrian system, which is mentioned here in the question. But I will go and I will see more. I know that we are working with a strong distributor, and we have pilots in several Austrian hospitals. And I will very soon learn more about it. But I cannot make any comparison between this ELGA system and our system. I should say that.
Ivailo, that's the reason why we do all these conferences.
Yeah.
Encouraging people to come closer together and exchange their views. So you will do that, and probably you will inform Nikolaus in Hanover on the results.
Yes, I will, but I need to know more about this. Right now in Austria, if it's specifically about Austria, now we are piloting integration in of our system Checkpoint Cardio in Upper Austria hospitals, which I think are 12 hospitals.
Okay.
So maybe I can, Josef. The question of Frank goes to me. I understand that he says at Attila.
Yeah. So I didn't get it as question to me actually.
So I misunderstood. I'm confusing each and everything.
No.
Sorry. Attila.
That's no problem. So the ELGA system is the national system of Austria, and our system is quite different from that. So the ELGA system is an opt-out solution. So every Austrian gets that solution, and they have to declare that they do not want to participate. And they cannot delete any of their data, but they could only hide it from the healthcare providers, as it's actually a system from healthcare provider to healthcare provider. And the Smart for Health system tries something different. We want to connect the different national systems to the patient, so that the patient is not a patient anymore, but a citizen collecting data from different sources and putting it into one file. So they are managing that data. They can delete it. They can share it with other healthcare providers and other systems. And this is, in that sense, not a healthcare provider to healthcare provider solution as ELGA is.
Okay, thanks. I think the differences became clear. And if there is further interest in debating that, Frank will contact you. It's not that far away from Hanover to Potsdam. Now I would like to address the polls, because they are addressing these issues of how to come from pilot projects to broader use. May we have the poll questions? So we are waiting and waiting. The poll questions, please. So if they do not show up, I will continue. And as you probably know, the first draft, the proposal for a joint declaration of this Scanbalt Digital Forum has a proposal for a kind of monitoring system that shows interesting projects, shows evaluations of pilot projects, of results, progresses, and even bottlenecks and hindrances. And we could use this kind of monitoring system for learning from each other's, and what is maybe more relevant, for encouraging or pushing health policy makers to go for broader use of promising solution. And that is particularly relevant for reimbursement issues. And my question is, could you imagine that this kind of, such a kind of monitoring system could help to bring more speed with respect to deployment? So who will start to answer this? The questions of the polls are, does it make sense to establish such a European-wide telemedicine, telecare monitoring system? And the second question is, could you and your organization mobilize time, money, and enthusiasm to contribute to such a monitoring system, to develop and to run it? Yes, we can wait for Europe, for the European Commission, or for national governments to give money for such a system, but we are under pressure. We need quick answers and quick progress, and we need more speed. And insofar, my question is, couldn't we do it ourselves by the activists who are doing the research and doing the pilot projects? So these two questions. But now answers, responses from the panelists. Who wants to start? Orientina Di Giovanni?
Hi, everybody. So the question is, can a pan-European monitoring system on such innovation and pilot initiatives help us in establishing a clear framework to access the market for digital healthcare innovation? And I have in mind the United States. I have in mind an environment where money is easy to access and startups are financially fed thanks to a long list of venture capitalists. And the FDA, somewhat influenced by the tech giants, quickly develop pathways to catch innovation and get it in the market. And we are talking about monitoring pilots. I think, yes, it might be useful, it might be interesting, but I think it's not enough. I think we need to speed up something else, at least on the regulation side, because we have no means to change the mindset of our wealthy people and to make them more inclined to invest in risky activities such technology startups. But we can, as citizens at least, push our politicians to speed up the establishment of a European framework for digital innovation startups. Otherwise, we will see what happened already in other industries 20 years ago. We will be colonized by tech giants from the US, and then we will be left 20 years later to fight in order to get competition rules respected and our tax bill paid. Sorry, I'm very radical, but I think it is time to say.
No, I really appreciate that. We have to find clear words to go for understanding. Now I would like to ask Eila, what do you think about such a clear view from a finish point of development? Do you have the same? And could you contribute in encouraging policymakers?
Yes, absolutely. I think we in Europe, we are wasting time and money doing the same efforts in every country or every county even. And absolutely, for example, regulation issues and safety issues and, for example, cost-benefit data should be shared in Europe scale.
May I say?
Eila, yes, Ivailo wants to respond. It's up to
yes,
you.
I would rather share my experience because as far as I saw all the presentations, I think the Checkpoint Cardio is the only company which has industrial solutions. So we are, first of all, a regional equipment manufacturer. We do all the devices. We produce the devices locally. We produce our medical applications and server software also by ourselves. So, and now we are running a pilot in several European countries. And the last pilot we started was in Canada. And this pilot is moving 5 times quicker than all the pilots in Europe. Despite that we don't have still FCC and FDA, and still, yeah. And today in North America, because of the coronavirus, they have a special regulations just for innovations which are concerning COVID-19. And today the FDA, everybody with a CE mark can get FDA for 2 months instead of 6 months for much less money. What I want to say and why it's happening, because I don't know about US, but for Canada, I'm pretty well informed. They have a perfect reimbursement system. Because, you know, when you go, from our point of view, because we have a complex system, we have our device, our software, and our chain of medical centers, which are monitoring those patients in real time. And now we are establishing medical centers for monitoring in several countries, including Austria and very soon Germany. So from our point of view, the quickest way in order to get these innovations industrialized, not only with pilots, is that there should be financial appreciation of these innovations. Because in the end of the day, you go to hospital, you go to ambulatory center or to research organization, and finally, the first question, okay, in Europe, the first question is, who pays the bill? In North America, I would say is what is your innovation and how different is from the others. And here, from our point of view, the main problem is that we have issues in different countries with absolutely different reimbursement systems for healthcare. And if these doctors and or hospitals or other clients or partners do not know who will reimburse this real-time monitoring, integration of technology for real-time monitoring for ambulatory patients or in-hospital patients, they will never start it. Unfortunately, it's like this. So I would say, and I read the declaration, unfortunately today, I didn't have this thing before, but I fully support all the things which are concerning the reimbursement system, because the market will do it itself. No need of policies and too much talking on European level.
Again, thanks for this clear view and clear knocking at the door. Come on, we have to deliver. Now I want to address Attila from the Hasso-Plattner Institute, which is well known for its interest in high-speed innovation. What's your view on these issues?
Thank you. I have two views on this. The first view is from the Smart for Health project perspective. Of course, it makes sense to think Europe first, instead of starting in a national context or a federal context. When addressing European needs across borders, things develop differently than when I start in one nation and then I try to scale it up into different ones. So this is what we see as the project. Now, my personal perspective is, I also want to add that, so I think federal states and the whole national systems that we have within Europe is also a safeguard for too quick developments. So redundancy is also always a sign for quality. So when we think of different national systems and developing things in parallel, we ensure that the systems that are in the end in place are actually well suited for the things, especially in the healthcare system. this is something that I've also find valuable to pursue.
Okay, thanks. So I was reminded of the fact that our time is coming to an end, and insofar I would like Thomas to do some kind of wrap-up, summarizing, concluding remarks. Thomas, what would you think? Is it still a good idea to go for this monitoring system? And what did we learn?
Yes, definitely. I would definitely support that because we have, even in Germany, we have so many different solutions, and but many regions do not know what the other region is doing, and I think the same is true for, or especially true for, or more true for Europe. And I would definitely support such a monitoring system. And I would also highlight the fact that we should more collaborate. We have heard today many times the saying, sharing is caring. And I would suggest to collaborate more. We have a good experience in this. I have been working in open source for a long time. And one good example is the Linux system. And I'm sharing a group for medical informatics, open source, and there are plenty of very good open source systems, and where you can also share your workload. And it doesn't make any sense to develop something 100 times in parallel. We do not need 130 apps doing for diabetes. So that's not something to be against. A good, several systems, but I think collaborative development is definitely something that we should look at.
Thank you, Thomas. So I will come to an end by, let me say, adding some bullet points of what we learned with respect to the monitoring system. Orientina said, yes, we should have it. However, we need more. And more is more or less a European framework. And as Ivailo outlined, we need something like a fast track for promising innovations, like it's done in Canada and in the US. That could be helpful, and maybe the COVID-19 crisis is a booster for such a kind of fast track. When developing such a kind of fast track, the reimbursement issue is absolutely essential. That's, let me say, the most essential, most relevant issue we have to solve. And if we solve that, the market will do the rest of the challenges, will cover the rest of the challenges. However, we should not forget that we are living in Europe, and Europe wants to profile itself and has a good starting point for that, to work on a high quality way of developing these issues, and we should not forget that. I think that's the message of this session today, and I am very thankful for your contributions. I apologize for my confusions. Hopefully they worked as a wake-up call for some people in the audience, but nevertheless, excuse me, I will try my very best next time to avoid that. However, again, thank you. And have the patience and the time to attend the concluding keynote by Mr. Mager. And I'm sure he will summarize all what happened today, and he will condense it to 5 bullet points for the European presidency. And insofar, you should support him and listen to him. Thanks for your active input, and see you again as soon as possible. Have a nice weekend.
Thank you very much. Good luck to all.